The coronavirus pandemic is escalating at a much more dire pace in 2021 compared to just last year. On average, the U.S. is adding more than 271,000 new cases per day. And public health experts warn that the crisis will continue to worsen in several hard-hit states. Meanwhile, former FDA Commissioner Dr. Scott Gottlieb told CBS News that the country's strategy for administering coronavirus vaccines isn't working and that the U.S. needs to hit the reset on its approach. According to the CDC data, only about 6.6 million people have received their first shot out of more than 22 million doses distributed. So for more on this, let's bring in Dr. Ron Elfenbein. He is the medical director and owner of First Call Medical Center. Thanks for joining us, Doctor. Several states' governors have announced plans to broaden access to the vaccine to other high-risk groups. Do you have any concerns that this could bring more chaos to an already overwhelmed distribution operation?
Yeah, good morning, Vlad and Emery. Yes, that's a very good question. I think that there is some concern about that. As you said, Emery, you really hit the nail on the head. It is a overwhelmed system, and that portends to probably just be more overwhelmed as they've added in more more people to vaccinate. It's really a logistical nightmare because you have to not only plan for their first vaccine, but then you also have to make sure they're available for their second vaccine. That requires a lot of planning, a lot of man hours, a lot of logistics, and a lot of organization. So the more people you throw into the mix to do that, the more difficult this becomes. When it's just physicians and nurses and the hospitals are doing it, they have a little bit more control because those are the people who generally would work at their institutions. It's a little bit easier. As you start broadening that group, it becomes way more complicated. And if you don't vaccinate someone with their second dose, then you might as well not have given them anything. So it really becomes very, very difficult.
Dr. Elfenbein, on Friday, the incoming Biden administration announced that it would distribute every available dose of the coronavirus vaccine. This is a major reversal from the Trump administration's strategy of keeping some vaccines in reserve so that everyone who receives a first dose is guaranteed a second. Do you anticipate the Biden administration's strategy to be more effective in getting more of the population immunized?
That kind of mirrors what the UK has been doing, and I think that's a really, really big gamble, and it's a big roll of the dice. Potentially, it could really pay off, and it could be amazing, or on the flip side, it could be a disaster. So I don't really know. I'll give you an example. So I got my first dose 3 weeks ago, roughly 3.5 weeks ago. I was supposed to get my second dose after I worked a shift in the emergency room on this past Wednesday. But I got a call the day before saying, we don't have any more vaccine. You got to reschedule it. So luckily I was able to do it. And remember, you only have a window of a couple of days to reschedule it. So luckily I was able to reschedule, and I was able to get the second dose of the Pfizer vaccine because the hospitals are at the mercy of whichever one they get. It could be Moderna one day, it could be Pfizer the next day. They don't really know. So I anticipate that problem being a difficult one going forward too, because if you get the first dose of Moderna, you can't then get a Pfizer dose. And vice versa. You have to get the same vaccine, and it has to either be 21 or 28 days apart, depending on which vaccine you get. So, if you start saying, well, we're just going to give everybody their first shot, not worry about giving the second shot, yes, you will induce some immunity in the herd, in the population. But what that does, how much immunity people will get, how efficacious that will be, we don't understand and we don't know. So that's really a very large gamble, and you're really hoping that you're going to get enough vaccine on the back end to make up the difference for all those people. And that's a big, big, big risk.
So in early stages of the pandemic, major outbreaks were kind of concentrated in certain geographic regions in the United States. Of course, the Northeast saw it, the Sun Belt, the Midwest. Now the worst hit states seem to be scattered across the country: Arizona, California, Oklahoma, South Carolina. What are the factors that are leading to the surges in these states? Rhode Island, there you go.
Yeah, sorry, I didn't mean to interrupt you. I think part of this is Rhode Island, for example, has an older population, and it tends to be very densely populated. Obviously, Arizona is not quite the same. California is another densely populated state. I think part of this is the sort of post-Christmas / New Year's surge that we're seeing. We expected it kind of 2 weeks out, and we're starting to see it. Why South Carolina, for example, I don't really understand. I don't really know. Arizona, was hit very, very hard months ago. California was hit very hard months ago, and I think part of it is that people just sort of, relaxed and they figured, well, we've already had our turn and now it's somebody else's turn. But unfortunately, once you start relaxing your standards and start relaxing, social distancing and mask wearing and things like that, you run the risk of this kind of thing happening. So I honestly, I don't know why those 4 or 5 states really are the ones that were hit so hard, but it is very concerning. And I do believe that there's some degree of the post-Christmas, New Year's surge to blame for this.
All right, Dr. Ron Elfenbein, always great to have you, my friend. Thank you very much. Stay safe out there.
Thank you. You too, guys. Good to see you both.